Everyone thinks a concussion seems to be like, hey, you get that one smash hit and all of a sudden you're dinged up. But really, I didn't notice I had one until it took a total of 20 minutes, pretty much of a whole period of, 2-minute drill and blitz pickup, things of that nature. They call your number, it's like, hey, Matt's up. And it's like, wait a minute, I'm not up because I have to, you know what I mean? I'm not feeling too good right now. So, and that's pretty much how it started. They took me in and examined me and, lo and behold, concussion.
Hi, I'm Dr. Mickey Collins, and I'm the Clinical and Executive Director of the UPMC Sports Medicine Concussion Program. Today, I'm going to talk to you about common signs and symptoms of a concussion, as well as a test called IMPACT that all athletes should take before the season starts and after a concussion occurs. At UPMC, we've studied concussion for many years and have learned some very interesting facts about the injury. First is 1.8 to 3.6 million concussions occurring per year in this country in sports and recreational activities. We've also found that younger kids or children take longer to recover than adults. When you compare high school kids versus college athletes, high school kids take the longest to recover. When you compare high school kids to NFL players, they take longer to recover. We've also learned that many men may not realize that outcomes in girls may be a little more dangerous than outcomes in boys with concussion. We've also learned that management of concussion is absolutely critical. If you allow the brain to recover following concussion, we don't necessarily see a cumulative effect of the injury. The best way to prevent problems with concussion is to manage it effectively when you have one and to make sure the athlete's fully recovered before they go back to play. The word concussion literally translates from Latin to English to mean to shake violently. Think about the brain as an egg yolk inside an eggshell, and the brain moving inside the skull is going to produce what we see with concussion. At the end of the day, what happens with concussion is that certain chemicals come out of the cell that shouldn't go out, and certain chemicals go into the cell that shouldn't go in, produces an energy problem to the brain. We know that we have to allow patients to recover fully from this injury. If these energy problems are not recovered fully and an athlete goes back to play too soon, far less force is going to cause far more serious outcomes. And we also don't want to push kids through this exertionally because there's an energy problem, so it has to be managed very carefully.